Hey everyone, welcome back for another deep dive. Today we're going to try to learn about trans and gender diverse healthcare.
Sounds good.
Yeah, we've got some fascinating sources here. We've
hmm
got excerpts from the 8th edition of the Standards of Care for the Health of Transgender and Gender Diverse People,
Huh?
the 2012 documentary Trans,
Yeah.
and the U.S. Transgender Survey.
Wow. That's a really interesting mix.
Yeah, it is. It's going to give us like a really well-rounded look at this topic, I think.
I think so too.
So the standards of care, those are created by WPATH, the World Professional Association for Transgender Health.
Right.
They're meant to guide healthcare professionals in providing competent and ethical care.
hmm
So kind of like the gold standard.
Yeah, like the ultimate guide.
Exactly.
Yeah.
Then we've got the trans documentary, which offers like personal stories and perspectives from trans individuals and their families. So it gives you a glimpse into their lives and the challenges they face.
Right, more of a human view,
Yeah.
a human perspective.
Yeah. And then the U.S. Transgender Survey is like a large-scale national survey. So it gives us all this hard data.
Oh, okay.
It paints a picture of the trans experience in America, like healthcare access, discrimination,
Hmm.
all sorts of things like that.
So we're not just getting the medical side, but also the
Yeah.
social and personal.
Exactly. The goal here is to give you a much deeper understanding than you would get just from reading headlines,
I like it.
right?
I like it a lot.
So one of the things that really jumped out at me in the standards of care was how much they emphasize using respectful and culturally sensitive language.
Okay.
And they really make it clear that this is not about like policing language.
Right.
It's about ensuring that people can access care based on informed consent, not on like what words they use.
That makes sense.
Yeah. So I was wondering, why do you think this focus on language is so crucial in a healthcare setting?
Well, I mean, imagine you go to a doctor and they use the wrong name for you or the wrong pronouns. How are you going to feel about that?
Yeah, not great.
Exactly. It undermines trust. It makes you feel disrespected, and it can even prevent people from seeking care at all.
It's true.
You
Yeah.
know, they might be afraid of being judged or misgendered or even denied care.
Yeah, I mean, the secretaries of care also say that terminology evolves over time.
Yeah, and it varies across cultures too.
Right. So it's really about being sensitive and willing to learn and adapt.
Right, and being open to what the patient is telling you.
Absolutely. So another key takeaway from the standards of care is that gender diversity is not a pathology.
Yes, this is huge. The idea that being trans is somehow a mental illness is a harmful misconception. It's just not true.
Yeah, and the standards of care really emphasize that gender diversity is a normal aspect of human experience.
It's about recognizing that there's a wide range of gender identities and expressions, and none of them are inherently wrong or unhealthy.
So then what are some of the other misconceptions that you think are out there about gender identity?
Oh gosh, where do I even begin? I think one of the most common ones is that being trans is a choice, or that it's just a phase that people will grow out of.
Ugh, yeah.
And that's so damaging because it invalidates people's lived experiences and ignores the very real distress that many trans people experience when their gender identity doesn't align with the sex they were assigned at birth.
That's where I think the U.S. Transgender Survey and the trans documentary really come into play,
Totally.
because they show us the real-world consequences of those misconceptions.
Right. They paint a stark picture of the discrimination and violence that trans people face.
Yeah. The survey found that over 40% of trans people have experienced some form of physical or sexual assault because of their gender identity.
Yeah, and the documentary brings those statistics to life. You see the fear and the pain in people's eyes as they share their stories. It's incredibly moving.
I mean, one person in the film was actually committed to a mental institution for 2.5 years just for being transgender.
I know. It's chilling to think that something like that could happen. It really shows how deeply ingrained the stigma is.
And it's so clear that those kinds of experiences take a huge toll on mental health.
Absolutely. The survey shows that trans people experience much higher rates of depression, anxiety, and suicidal thoughts than the general population.
And the standards of care actually acknowledge that.
Yeah.
But they make it clear that it's not because being trans is inherently a mental illness.
Exactly. It's the constant stigma, discrimination, and lack of support that contribute to those mental health disparities.
So how can healthcare providers help address that? How can they create more affirming environments for trans folks?
Well, I think it starts with basic respect, using the right name and pronouns, listening without judgment, taking the time to understand each person's individual needs.
So it's about going beyond just treating physical ailments.
Right. It's about recognizing that mental health is deeply intertwined with a person's sense of self and their experiences in the world.
It's about treating the whole person.
Ex-
All right, so let's shift gears a bit and talk about gender-affirming medical and surgical treatments, also known as GAMS.
Oh.
The standards of care outline recommendations for providing things like hormone therapy and surgeries.
Yeah.
But they're very clear that it's not a one-size-fits-all approach.
Oh, absolutely. Every person's journey is unique, and GAMS should always be tailored to the individual's needs and desires.
You know, in the documentary, one person talked about how they identified as a lesbian for years before realizing they were actually a transgender man.
Mm-hmm.
It shows that these things can be really complex and evolve over time.
Yeah, and that's why it's so important that healthcare providers approach these situations with sensitivity and expertise. Not making assumptions and really listening to what the person is saying.
So let's talk about detransition and regret, because that's something that often comes up in these conversations.
Right. The standards of care address that too. They point out that detransition is actually quite rare. And when it does happen, it's often driven by external factors like intense societal pressure or lack of support, not because the person's core identity has changed.
I remember in the documentary, there was a story about a person whose family basically gave them an ultimatum,
Oh, God.
like detransition or be cut off from the family.
Wow.
So yeah, it really highlighted how much external pressure can influence these deeply personal decisions.
That's heartbreaking. It just goes to show how important it is for healthcare providers to support individuals who are considering detransition.
Yeah, to help them make informed choices that are truly in their best interests and not based on pressure from others.
Exactly.
So the standards of care also talk about social transition as something to consider alongside medical transition. What does that actually mean?
Well, it means changing things like your name, your pronouns, your clothing, how you present yourself to the world, basically.
Okay.
It's about aligning your outward expression with your internal sense of self.
And the documentary gives some really cool examples of that.
Like even simple changes, like using a different name, can make a huge difference in a person's well-being.
Oh, absolutely. It's about being seen and treated as the gender you truly are,
Yeah.
which can be incredibly validating.
Okay, so now let's talk about children and adolescents, because the standards of care offer specific guidelines for working with gender-diverse youth.
This is such an important topic.
Yeah, they really emphasize the importance of a supportive and affirming environment.
Yeah. I mean, families and schools play a huge role here in creating spaces where young people feel safe, exploring their gender identity without fear of judgment or rejection.
There's this one scene in the documentary that really stuck with me. This young girl tells her mother that she wishes God hadn't made a mistake when creating her.
Oh, wow.
And it's heartbreaking, to hear a child express those kinds of feelings.
It just shows how early these feelings of gender incongruence can emerge and how crucial it is to provide support and affirmation.
And it's not just about binary identities either.
Male and female. The standards of care recognize the full spectrum of gender identities, including non-binary identities.
Which is so important because non-binary folks often face unique challenges, even within the LGBTQ plus community.
Yeah, the survey found that they often experience discrimination and have difficulty accessing health care that meets their specific needs.
It's a reminder that we need to be mindful of our language assumptions. Not everyone fits neatly into those boxes of male and female.
Speaking of diversity, the standards of care also have dedicated chapters on caring for eunuchs and intersex people,
Okay.
which is really about recognizing that the principles of gender-affirming care apply to everyone.
Right. It's about meeting people where they are and providing care that's tailored to their individual needs.
So, okay, let's talk about the role of primary care providers,
All right.
because they're often the first point of contact for trans people seeking health care.
Right. They're the gatekeepers in a lot of ways.
And the standards of care really emphasize the importance of primary care providers being competent and culturally sensitive.
Yeah, but the problem is that a lot of doctors and providers don't receive much training on transgender health in medical school.
Yeah. So what do you think are the key things that primary care providers need to know in order to provide good care for trans patients?
Well, first and foremost, they need to understand that a trans person's healthcare isn't just about their transition.
Okay.
It's about addressing all aspects of their health, physical, mental, and social.
Right. So it's about recognizing that trans people have the same healthcare needs as everyone else, but they may also have additional needs related to their gender identity and transition.
Exactly. And they need to be comfortable talking about sensitive topics like sexual health, reproductive options, hormone therapy, and gender-affirming surgeries.
And the standards of care really emphasize the importance of open and honest communication.
Yeah, it's about creating a space where patients feel safe, asking questions and sharing their concerns.
And it's about providing accurate information so that trans people can make informed decisions about their bodies and their futures.
Totally. So we've covered a lot of ground here, just in this initial look at these sources.
It's a lot to take in, right?
It is. It really is. But it's so important to understand these issues.
Yeah, I agree. Maybe now would be a good time for everyone to just pause and reflect on what we've learned so far.
That sounds like a great idea.
We'll come back and pick up where we left off in the next part.
Looking forward to it.
Okay, cool.
Yeah. It's amazing to think about how much progress has been made in trans healthcare, even just in the last few decades.
I know, right? It makes you realize how important it is to keep learning and challenging those assumptions.
Absolutely.
So before the break, we were just about to dive into hormone therapy. The standards of care really go into detail about the different types of hormones and how they're administered.
Yeah, it can get pretty complex.
Can you give us like a quick rundown of the basics?
Sure. So basically, hormone therapy is about aligning a person's hormones with their gender identity. So for trans women, that often involves estrogen therapy to bring about changes like breast growth and softer skin. And for trans men, testosterone therapy is more common, which can lead to things like a deeper voice and facial hair.
Yeah, it's incredible how hormones shape our bodies, right?
Yeah, it really is.
But I imagine there are also risks to consider with hormone therapy.
Oh, absolutely. Like any medical treatment, hormone therapy has potential risks. The standards of care are very thorough in outlining those risks, which can include things like blood clots and certain types of cancers.
And they also mentioned that not all estrogens are created equal.
Right. That's a really important point.
Like they specifically said that some types of estrogen, like oral estradiol, carry a higher risk of blood clots.
Yeah, that's why it's crucial to work with a knowledgeable healthcare provider who can explain the different options and help you find the treatment that's safest and most effective for you.
So if you're thinking about hormone therapy, do your research and talk to your doctor about the risks and benefits.
Yeah. And make sure you're getting regular checkups and blood tests so your doctor can monitor your hormone levels and catch any potential problems early on.
So hormone therapy is a big commitment, for sure. But for some people, it's not the final step in their transition. That's where gender-affirming surgeries come in.
Right. The standards of care talk about a whole range of surgical procedures that can help people align their bodies with their gender identities.
In the trans documentary, one person described feeling so much distress over their body that surgery was the only way they could imagine feeling whole.
Yeah, it's a really personal and often emotionally charged decision.
So what are some of the most common gender-affirming surgeries that people have?
Well, it really depends on the individual's needs and goals. But for trans women, it might involve things like breast augmentation or facial feminization surgery. And for trans men, it could be chest masculinization surgery or a hysterectomy. And there are also surgeries for non-binary folks who want to modify their bodies in ways that align with their gender expression.
So there's a whole spectrum of options available.
Yeah, there really is.
But like with hormone therapy, I'm guessing there are also risks to consider with these surgeries.
Of course. These are complex procedures, and it's important for people to understand the potential complications, the recovery process, and the long-term implications. Informed consent is absolutely essential.
Right. No one should be pressured into having surgery.
Exactly. It has to be 100% their choice.
And the standards of care are very clear about that.
Yeah.
They lay out specific criteria that need to be met before someone can have these surgeries.
Right. Things like psychological evaluations, hormone therapy, and often social transition to make sure the person is fully prepared in making an informed decision.
I'm noticing a theme here.
Yeah.
It seems like the standards of care really emphasize a team approach to care.
Yeah, it's a recognition that trans folks often have complex needs, and it takes a village, so to speak. You might have a mental health professional, an endocrinologist, a surgeon, a primary care doctor, all involved in someone's care.
And then there's support groups and community resources too.
Oh, absolutely. Those can play a huge role in providing emotional support and a sense of belonging.
So it's not just about medical care. It's about holistic care for the whole person.
Exactly.
I'm really enjoying how we're weaving together the clinical information from the standards of care with the personal stories from the documentary.
Me too. I think it makes the information much more relatable and impactful.
It's a good reminder that we're not just talking about abstract concepts here. We're talking about people's lives.
Yeah, and creating a more just and equitable society for trans people requires more than just medical expertise. It requires empathy, understanding, and a willingness to challenge our own biases.
So let's talk about some of those broader challenges that trans people face. The U.S. Transgender Survey paints a pretty sobering picture of the discrimination they experience in almost every aspect of life.
Yeah, it's eye-opening to see the extent of the problem.
Like at school, at work, in housing, even within their own families.
The survey found that nearly a third of respondents had experienced homelessness at some point in their lives,
Wow.
and over half had been denied access to a public restroom because of their gender identity.
It's hard to believe that people are denied basic human rights just because of who they are.
It's a sad reality. And of course, that kind of discrimination takes a toll on both mental and physical health.
And then there's the violence.
Right. The survey also highlighted the alarmingly high rates of violence and harassment against trans people, especially trans women of color.
It's a reminder that we have a lot of work to do to create a society where everyone can live safely and authentically.
And that work needs to happen on a systemic level. We need to address the root causes of this violence and discrimination.
So it's not enough to just focus on individual medical care.
Right. We need to advocate for social and political changes to create a more just and equitable world for everyone.
We've talked a lot about the medical side of things, the hormones, the surgeries, the challenges of accessing care.
Yeah, we've covered a lot.
But there are a few more important areas to touch on before we wrap up this deep dive.
Okay.
We need to talk about reproductive health and sexual well-being.
Right. These are crucial aspects of overall health and well-being for everyone, including trans folks.
So before we jump into those topics, should we take a quick pause and let everything sink in?
That sounds like a good plan.
So we've covered a lot about trans healthcare and how important it is to approach it with sensitivity and a focus on individual needs. You mentioned that we need to talk more about reproductive health and sexual well-being.
Absolutely. Those are essential aspects of overall well-being for everyone, and especially for trans folks. It's crucial to understand that gender-affirming care isn't just about physical transition. It's about supporting individuals in making informed choices about their reproductive options and helping them navigate the complexities of sexual health.
Yeah, the standards of care are very clear about the need for open and honest conversations between patients and providers about these topics. I imagine those conversations can be pretty sensitive.
Definitely. They need to be approached with a lot of care and sensitivity and tailored to each person's individual needs and desires. For some folks, it might involve discussing fertility preservation options like freezing eggs or sperm before starting hormone therapy. For others, it might be about understanding how hormones or surgeries could affect sexual function and sensation.
Right. It's about acknowledging that these are really important parts of a person's life and deserve to be addressed with expertise and compassion. The standards of care also mention that some trans people may seek treatment for sexual dysfunction or pain related to their gender identity or transition.
That's right. Healthcare providers need to be knowledgeable and sensitive to those unique needs and create a safe space for people to discuss these very personal issues.
Now, we've talked a lot about the general principles of trans healthcare, but we also need to address the systemic barriers and disparities that exist within the trans community. The U.S. Transgender survey was really eye-opening in terms of the experiences of trans people who are incarcerated.
It's a really disturbing reality. The survey found that trans people are disproportionately represented in prisons and jails, and they often face terrible abuse and mistreatment.
Like what kinds of things?
Well, they might be denied access to hormone therapy. They might be placed in facilities that don't match their gender identity. They might experience violence from both inmates and staff. It's a very grim situation.
Yeah, it sounds like a complete violation of their human rights. I did notice that the standards of care have a whole section on caring for trans people in institutions. They really stress that these individuals deserve the same level of care and respect as anyone else.
You'd think that would be a given, but unfortunately, it's not always the case. And it leads to a lot of harm and trauma. This isn't just about changing healthcare practices. It's about reforming the criminal justice system as a whole, addressing the root causes of mass incarceration and the over-policing of marginalized communities.
And there's another vulnerable group that we need to talk about: trans people living with HIV.
Absolutely. The intersection of HIV and transgender identity is a major concern. Transgender women, especially trans women of color, are disproportionately affected by HIV, and they often face unique barriers to accessing quality care.
The standards of care talk about the need for culturally sensitive care for trans people with HIV. What does that look like in practice?
It means understanding how hormone therapy and HIV medications interact. It means addressing mental health concerns. It means providing support around sexual health and risk reduction. It's about recognizing that healthcare for this group needs to be holistic and comprehensive.
So as we wrap up this deep dive into trans healthcare, what are some of the key takeaways you hope our listeners will remember?
Well, I think the most important thing is that transgender healthcare is about so much more than just medical procedures. It's about respecting and affirming a person's identity, understanding their unique experiences, and providing compassionate, individualized care.
And it's about recognizing that being transgender is not a pathology. It's a natural part of human diversity.
Right. We also need to remember the systemic barriers that impact the health and well-being of trans people. And we all have a role to play in advocating for change.
We've learned so much from these sources. The standards of care, the trans documentary, and the U.S. Transgender Survey. Each one offers valuable insights into the lives and experiences of trans people.
I hope this deep dive has encouraged you to keep learning and to become an advocate for greater understanding and inclusion.
Yeah, I think you've given everyone a lot to think about. Here's one final thought to leave you with. The U.S. Transgender Survey revealed alarming rates of discrimination, violence, and healthcare disparities. So what can we do as individuals and as communities to create a world where everyone, regardless of their gender identity, can live authentically and have access to the care they need? That's something I hope all of us will continue to think about and work towards.
It's a call to action for all of us to keep learning, to challenge our own biases, and to work together to create a more just and equitable world for everyone.
Thanks for joining us for this deep dive into trans healthcare. Remember, learning is a journey, and understanding the experiences of marginalized communities is an important step in building a more inclusive world for everyone.